What's up guys, Doc Chris here, the Scrubby MD, and welcome to another video sa ating channel. Kagagaling kong duty, medyo pagod, joke lang, kunti lang pasyente. Actually, naging medical officer, senior doctor in charge ako sa hospital recently for the past 2-3 weeks. And by next month, I will be training also. No, or pa-training ba yung term doon? Or may rotation ako sa Manila for toxicology. And it will be exciting. Pero unfortunately, wala akong siguro mga videos na i-upload for the next month kasi yun nga, I will be outside of my comfort zone and will be focusing more on managing or understanding basic toxicology. May topic lang ako gustong i-touch today kasi interesting siya kasi it's more of an occupational related condition / autoimmune condition na not commonly discussed. So may papakita kong picture sa inyo. Actually, interesting enough, hindi siya madalas meron sa clinic pero maganda siyang pag-usapan. Okay, pakita ko lang. Yan. Okay. Kinuha ko to sa, I think it's NIH, National Institute of Health. And often we see patients with complaints of musculoskeletal problems. Musculoskeletal meaning laman tsaka yung mga buto-buto. No? Mga matatanda ang nakikita namin kadalasan sa clinic namin kasi yun nga, overwork, pagod, kumakayod para sa pamilya at tsaka sa sobrang pagpapagod ng katawan nila, nagkakaroon na sila ng sakit sa kalamnan, no? Tsaka sakit sa kasukasuhan, tsaka sa muscles, sa joints, no? And often dinidiscuss namin ang mga typical na complaints of yung arthritis, muscle spasms, musculoskeletal problems, or muscle strains dahil sa kanilang trabaho. But there is one particular scenario or case na kailangan din natin ma-bring up kasi not all the general population can have this particular na karamdaman. So, not all arthritis ay dala ng pagkatanda. Okay, there are a lot of arthritis na pwedeng makuha either genetically or acquired from an infection or even traumatically. So, traumatically, siyempre, una, pag na-aksidente ka. Pag infection, may tinatawag tayong reactive arthritis. It could either be from either a systemic illness or infection, sexually transmitted infection, or what. So, that is what you call reactive infection. Pwede rin from a bacterial infection. Meron yung tinatawag nating post-streptococcal reactive arthritis. Gonococcal arthritis or septic arthritis, yun, infection ang related doon. Now, how about yung galing sa family? This picture na pinapakita ko ngayon is a prime example of a hereditary condition na nakikita lang in people with a certain kind of gene. So, this picture is discussing what we call your Ankylosing Spondylitis. No, this photo is the photo of the neck. So if you would see the image here, magkakahiwalay dapat ang cervical vertebra. However, pag nakita nyo dito, may tinatawag tayong bridging or magkadikit sila. Okay, that is necessary for the definition. No? Kasi ang vertebras, they usually are separate. Magkakahiwalay yan. Pero for this particular scenario, magkakadikit sila. Another picture siguro para mas magandang tignan, this one. This is a reconstruction or a 3D reconstruction also from the NIH. Okay? So nakita nyo dito, wala ka na makitang separation from the bones. Magkakadikit na sila. Okay? And that is bothersome. Siyempre, hindi mo na yan magagalaw. Hindi mo na magagalaw ang inyong leeg normally. Okay? And the normal range of motion of your neck, yan, ang sobrang kwan yan. Sobrang affected yan. So, people with this type of joint involvement, okay, they need to have an occupational rehabilitation or occupational therapy para ma-mobilize pa rin yung mga joints sa kanyang leeg. And clearly yung lifestyle ng mga individuals with this particular condition, they should be very much managed with a multidisciplinary team. Kasi if hindi to mabantayan ng long term, it would lead to stiffening of the joints and the bone. And it would also lead to, well, immobilization of the joint itself, leading to a lot of comorbidities or disability. No? So yan, magkakadikit na yung cervical vertebra dyan. You have 7, no? C1 to C7, pero tingnan nyo yan, parang magkadikit na siya. So, another example, picture natin, yan. Okay, this is from the thoracic area. Take note, magkakahiwalay siya sa lumbar dito. So I think this is, if I'm not mistaken, this is between T12 to L1, bababa. L1, 2, 3, 4, 5. So, the lumbar area. Tapos, this is yung T1 to T12. Pag nakita nyo dito sa thoracic vertebra, yan, magkakadikit na siya. There is already a bridging between the vertebras. And pag yan, nag-lock in na siya, hindi na siya nagagalaw. And that is very bothersome also kapag sa thorax yan. Your thorax should be very flexible, especially nandyan ang ribs, and they are important in expansion, yung paghinga ng isang tao na may that is normal, no? So restricted ang, usually may tendencies na may restricted ang paghinga sa mga ganitong particular na scenarios na meron kang what we call your ankylosing spondylitis. So here are just some of those photos. Now, balipuntan natin, ano ba ang ankylosing spondylitis? Let's go to the National Institute of Arthritis, Musculoskeletal Diseases. So what is the diagnosis? So we go to siguro the basic na lang muna. For the basic, para lang sa layman, dapat ito yung dapat binabasa. Okay. So ankylosing spondylitis. So usually ankylosing, if you go to the definition of ankylosing, tingnan natin kung ano bang definition ng ankylosing from Mr. Google. Ankylosing. So, ankylosing spondylitis is a type of arthritis that causes inflammation of the joints and the ligaments. And they usually are, nagkakaroon ng bridging. Pag may bridging phenomenon kasi dyan, hindi siya mag-mobilize na maayos. So, what are the tests? Paano ma-diagnose ito? Actually, there's no single test. You have to see a doctor kapag meron ng complaints of back pain and difficulty in ambulating as early as childhood. Okay? Kung bata ka pa, nagkakaroon ka ng problema ng back pain, you have to seek consult ahead. For a thorough physical exam should be done, and a thorough medical and family history should also be done, and as well as the good evidence of radiographs, papa x-ray yan, pero titignan natin kung ano ba, how healthy your bones are at the back. So how is ankylosing spondylitis treated? So technically, sabi nga dito, there is no cure for ankylosing spondylitis. This is a type of a arthritis or pain of your bone or joints that has no cure as of the moment. But what we can do, yun nga, is to ease the symptoms. And you should also provide better occupational treatment. Paano ba yung occupational treatment sa mga ganitong cases? Well, first is, syempre, you should always have or teach them as early as the diagnosis to have a good posture, maintain a good flexibility, and good strength of the spine and the back para hindi sila manigas. Okay, that is the very uh, best thing for you to do if, well, let's say, a person is diagnosed with this condition. Huwag kang, don't be, this is the type of condition that should not be encouraged to be a couch potato. Kasi once you're a couch potato or just sitting all day, your back will just tend to stiffen and harden from day to day, and eventually you will be immobilized and hindi ka makakapag gawa ng mga trabaho mo for a foreseeable future, no? So this is one way for you to help yourself prevent the progression of this condition. Then keep the disease from progressing or slowing its progress. Kaya nga sabi ko nga, it's better for you to move, mag-exercise, maglakad if you have this condition. And don't let yourself, okay, be sedentary, na uupo lang and do nothing. You should always practice flexibility and strength as well as posture exercises for this type of scenario. And often these patients na meron siyang ankylosing spondylitis, meron silang mga either sessions with a physical therapist, whether it's a private physical therapist or they are enrolled in a rehab center para lang ma-maintain ang posture, at the same time educate sila on proper strength and flexibility exercises. So treatment, though we don't have any cure for this type of condition, yun nga, we should help them prevent progression. Physical therapy will help in preventing pain. Physical therapy also will help strengthen the muscles, at the same time improve joint and bone health, okay, and keep the person in good posture. Take note, if the bones stiffen and harden in a particular scenario or a particular posture na hindi mo na nagagalaw, it would be very bothersome. You cannot do proper activities like driving. You cannot do proper activities like walking. You cannot do proper activities like even riding a bike. Okay, you're eventually incapable of doing other activities that can be helpful in your life, in your day to day, if you let your body, okay, harden that much at hindi na nagtrabaho. So for those patients with this cervical condition, we often encourage them to have a better physical activity and guide it with a physical therapist, for that those joints will not stiffen or that will not be further damaged in the long run. Now, it's very expensive for the family, especially kapag, let's say, hindi na naiwasan yung progression. Well, the best treatment would also alleviate, okay, para matanggal lang yung hardening ng mga joints and ligaments, the surgery. And well, mahal yun. In our current situation sa Philippines, if there is an option for surgery, it is an option para lang maiwasan yung paninigas ng mga bones. But will it cure the patient? No. It's not a definitive cure for ankylosing spondylitis. Now, there are a lot of factors for treatment for patients with ankylosing spondylitis. And aside from bone and joint pain, this, take note, is a autoimmune disease. No, kung autoimmune disease ang isang karamdaman, it is a systemic condition. So there would also come a point that the HLA or the gene may also reactivate other autoimmune conditions. Isa dyan ang typical na psoriasis. Okay? Isa din ang mga typical problems like irritable bowel disease or chronic diarrhea or constipation. Pwedeng mag-present yun. And at the same time, problem on visual sa mata. We have your iritis or the inflammation of the iris. So, it is a multidisciplinary approach para lang ma-address kung may mga progression in the future. Because in the future, you will eventually anticipate na magkakaroon siya ng progression with other autoimmune problems. No? So, in-depth reading, tignan natin sa in-depth reading. I think lalabas din naman dun kung ano yung mga problems na mangyayari. Ito yung kanina eh. Ito. Yan. Actually, the gene na sinasabi ko nga is your HLA or this one. The prevalence of a particular marker, your HLA B27. This is a marker that is for Ankylosing Spondylitis. Kung positive ka dito, more likely magde-develop ka ng Ankylosing Spondylitis. So, ang mga presentations nga, sabi nga kanina, ito. So, it might present, the most common would be your sacroiliitis, okay? So, problems sa joints sa may bewang, okay? And then eventually, it would progress to other joints. From the digits, from the spine, it would present with buttock pain, okay? And then, peripheral arthritis ang would ensue sa mga patients na ganito. And sabi ko nga, di ba, aside from the joint pain, there are extra-articular manifestations or involvement ng autoimmune disease na to with other systems. Number one dyan, sabi nga, is, yun nga, ito, inflammatory bowel system. So it's usually 50% of the time. Most of the time, the patients with AS would develop IBS. And then, uveitis or your iritis also. So, opta sa mata. And then, psoriasis, which is 10% occurring. So, additional, it's also risk with cardiovascular diseases and brain to stem with systemic inflammation. So, later on, may possibility of carditis and other problems with regards to the cardiovascular system. Okay? So, ano ba ang magiging approach natin? Sabi nga kanina, it's a multi-systemic approach. Yeah. You have a team of a rheuma, a derma, a gastro, an opta, orthopedic, occupational therapist, physical therapist. Kami, in Marline, it's a primary doctor, a family physician, or an internist that would help you course through kung sino yung mga pupuntahan mo. But this will not work if the patient does not comply with the plan or the treatment of the team. So, it's best that sa amin, we have to involve the family with regards to decision making sa mga patients with ankylosing spondylitis. Dapat fully committed din ang pamilya in managing patients with AS. Okay? Sa mga case na to, why this case should be tackled today? Kasi AS usually occurs sa mga young individuals. Individuals with future. May mga pangarap. Siyempre kapag yung mga batang may pangarap, naudot dahil lang sa sakit na to, madidepress yan. Magkakaroon ng problems with regards to identity. They will find ways to make themselves feel better. And sometimes, making them feel better would resort to even exploding their own personality. Ang mahirap is yung nga, depression would be a problem that would engulf patients na mga bata na mag-develop with AS. Kasi they would resort to drinking, they would resort to vices, kasi the feeling of emptiness. Yun dapat ang kailangan iwasan para hindi sila maging non-compliant sa treatment. And I encourage family members, if you have family members with AS, to the family, syempre, support them that in a way na kailangan silang maggamot or kailangan silang mag-undergo ng treatment kasi they have their own future. Ang one way for us, it's not just us kasi hindi lang kami mga doctors ang magiging team players para pagalingin sila. It's with the family and with the patient. And it's the entire team. So it starts with the patient agreeing with the plan. And once the patient agrees with the plan, the rest, the management or the treatment would follow. And better quality of life ang habol namin in these certain conditions. Ayaw naman namin magkaroon siya ng the opposite, poor quality of life. So the better quality of life should be given to any patient in need of help. So hanggang lang naman, I think. Kasi AS, though it's a rare condition, it should always be something to be discussed kasi this condition is evident, and hindi lang siya osteoarthritis, hindi rin siya gout, hindi rin siya rheumatoid arthritis. You should if you have a family history of AS, Ankylosing Spondylitis, you should tell it to your doctor. And if ever you have children, well, you have to monitor them kasi it is hereditary at namamana. Okay? So, kadulo naman yung video ko. I hope. Ilang minutes ba ako? Wow, 22 minutes. Ang haba. Anyway, yun lang naman. And hopefully, may natutunan kayo sa simpleng topic na to. Hindi siya masyadong in-depth sa medical, but ang goal ko is to provide patient education for the family, for the patient, and letting you be aware kung ano yung mga susunod na plans for our patients na may mga ganitong certain conditions. And as a family doctor, I am just here as a friend and the doctor that will help the family cure the patient. And hindi lang yung patient kasi ang concern ko, yung buong pamilya. Okay? So again, this is Doc Chris, the Scrubby MD, and see you on the next video. Hopefully may isa pa akong video bago pumunta ang toxicology next month. And see you around. Okay. Saan na yung outro ko? And we're done.